Dr. Wayne Luchetti. I'm an orthopedic surgeon specializing in sports medicine and joint replacement. I currently see patients on our Bethlehem campus on Shainersville Road. I see patients in Wind Gap, and I see patients in our Easton office. Essentially, I was involved in sports my entire life. Senior year in high school, I blew out my right knee and went through reconstructive surgery, developed a very good relationship with my orthopedic surgeon, and just really kind of fell in love with the idea of taking care of athletes. I went to undergraduate at King's College in Wilkes-Barre, Pennsylvania, and then I went to medical school at the University of Pennsylvania in Philadelphia. I stayed at the University of Pennsylvania for my general surgery internship, and then I did a 4-year orthopedic surgery residency at the University of Pennsylvania. And then I switched it up a bit and moved to the West Coast, and I did a full year of sports medicine training and a fellowship in knee replacement surgery in Long Beach, California. My main focus of my practice predominantly is sports medicine, taking care of young athletes. They're great to treat. They want to get better. They want to be back on the field as soon as possible. So it's really kind of fun being able to change their lives after a major injury and getting them back to what they can do. And then the other area of my practice has kind of evolved into more degenerative type conditions, because they're very similar to my younger patients in that they come in the office, they can barely walk, and taking them through a joint replacement surgery, it can really change their life and get them back to doing what they really want to do. I was actually in another practice in Virginia before I moved here, and I can't say enough about Coordinated Health. It's really an amazing setup. We offer everything from, foot specialists to shoulder and knee specialists, and now we've taken that a further step to really focus on women's health. We have full service OBGYN, and now cardiology, we brought them on board. So it's really an integrated approach to medicine. Our information systems, our computers are set up in that if someone comes in for, a knee problem, but they were seen last week for their back, without even having to make a phone call, I can, pull up their note on the computer and really kind of get a sense and treat the whole patient. I love taking patients to our hospital. They're not going to get better nursing. I've been around I don't look that old, but I've been around a while, and the hospital that we've developed is really second to none in how we approach patients. It's all about the quality of care and the patient experience, and I think we just do a fantastic job. Well, I have 3 young girls, so they keep me very busy. They play soccer and volleyball, and they're swimmers. So not a lot of testosterone in my house. None of them play football, so it's kind of my football fix, Lehigh and Nazareth. Take my kids out, they hang out with me on the sideline. It's giving back to the community, certainly, but I think Lehigh, what I've noticed is I continue to age, and the kids are always 18 to 21 years old. They don't age, I age, but I think it kind of keeps me young, and I really love it. The perfect day for me is the operating room. Surgeons are funny creatures, especially orthopedic surgeons, because every few months there's a new kind of device out. Your learning curve, it never ends. You're constantly learning new things and trying new techniques, and the operating room is I find it so challenging, yet at the same time really relaxing. I love it. I love looking at a perfect x-ray that I put a perfect knee replacement in, or a perfect hip replacement. It's just so gratifying. What I tell my patients, they should really focus on 3 things, and that is core strength and flexibility. Flexibility, stretching. And I like my patients to back off the high impact stuff, focus more on low impact things like cycling, swimming. Yoga is huge. Some of the most in shape patients I see in their 60s and 70s do a lot of yoga. I try and treat every patient like they're my family member. Whether it's an older Medicare patient, I really try and treat them like they're my mom or my dad. And if it's a younger 40-year-old like myself, I try and treat them like my brother. I just want my patients to be happy.